Hello, everyone. Good afternoon. Good evening. Welcome to Creating a Head Start for Your Families. We are excited to have you all join us for this session today during the ACF Indigenous Programs Conference. Before we begin, we will be sharing some instructions on how you can interact during this session. My name is Delroy Grant, and I will be the ACF room monitor for the workshop as well. I'm sharing quick housekeeping item before I turn it over to our presenters today. First, if you have any questions during the presentation, please submit them in the chat box. Next, I will monitor and record any questions that you might have. If you have questions during the Q&A sessions, please raise your Zoom hand located at the bottom of your screen or submit your question in the chat box. We'll try to get to you as many questions as possible. Please note that I have provided a survey link, which is in the chat now for this workshop session in the chat box. We would appreciate capturing your feedback and thoughts in this session, which you can do by taking the survey after this workshop. Again, I've provided a link in the chat box, as you can see. The survey link can be found on the live agenda, also on the ACF IPC website, along with the session's presentation handouts for download. Finally, as a quick reminder, all workshop sessions have been recorded for on-demand viewing via the 2022 ACF IPC website until April 25, 2022. Please visit the live agenda page if you would like to view these recordings after the conference. I will now turn it over to our ACF workshop facilitators, Todd Lorth Triangle and Raquel Martinez, to begin. Thank you.
Thank you so much, Delroy, and good afternoon again and good evening to everybody who's joining us. Thank you all for taking the time to join this session. As Delroy stated, my name is Todd Triangle. I'm the Regional Program Manager at the Office of Head Start Region 11, and I'm excited and honored to be joined by my colleague, Mrs. Martinez. I'm gonna let her introduce herself. Raquel?
Great, thank you, Todd. Good afternoon or good evening, everybody. My name is Raquel Martinez, and I am a TNTA specialist with our TNTA network for Region 11, and I'm in Fairbanks, Alaska, where it's sunny right now.
Thank you. And to begin, I wanted to give a quick session overview. As many of you have seen probably in the description, today's session is titled Creating a Head Start for Your Families, and really, you know, there are multiple meanings for that. One, certainly just designing a Head Start program for your community, but also talking about really working to understand our community, understand the needs of our community and the resources that are there in our community, and using that information to be intentional about designing a program that sets a positive trajectory for our children and our families that we serve. And so today I'm gonna go through a little bit about community assessment and program design, and then I'm going to hand it over to my colleague Raquel to discuss a very important aspect, and that's of course recruiting and enrolling those children and those families to begin providing them service. So I'm going to go ahead and begin here. So to start us off, I kind of thought it was appropriate to start really at the roots and the intention of Head Start and the Head Start grant. So as many folks may know, the Project Head Start was created in 1965. It was created as a part of America's war on poverty. And the goal was to provide comprehensive early childhood education services to children from low-income families, and to provide children a head start to education and support eliminating cycles of poverty within a community. And so again, Head Start was created for a very targeted, specific population within these communities, oftentimes children and families who, without a Head Start, would not have access to these resources, whether they be education, health, or family well-being. And still today, here in 2022, the intention of Congress's appropriation with Head Start still virtually mirrors that and still is at the core of what we do. So I thought it was appropriate to begin with talking about community assessment and community need. So community assessment is perhaps the most vital aspect of any grant recipient in terms of their planning. whether this is a potential grant recipient who's looking to apply and become a grant recipient, or whether this is an existing grant recipient who is updating their program design. A vital community assessment tells us many things about a program, but some of the things that we're looking for certainly are how many age-eligible children and families are in the community. We're looking at how many income-eligible children and families are in the community. And we're trying to identify what those family-specific needs are. We're looking to see what resources and potential partners are already existing within the community. So in the case of our tribal communities, are there other departments or divisions within the tribe that provide support that we've identified our families need, or our families have identified they're in need of? What other service providers are in the community? And by this, we're talking about other providers of early childhood education, other early childhood development programs. So that could be childcare, that could be pre-K, daycares. And that's important, of course, because as I stated before, the Head Start program is targeted toward a specific population. And you're going to see it in one of the other bullets provided just below. And that says how many age income eligible children and families are in the community and unserved. So again, really narrowing down that target population to those eligible families that are not currently served by another provider. And then, of course, it's going to help us determine what models best serve those families. So typically, Head Start programs, the majority, I would say, operate in a center-based program model where children and families come into a center, into classrooms, and receive services there. We do have programs that also provide home-based slots. And in that case, it consists of a dedicated staff member going into that family's home to support that child and family in the home. So in doing a community assessment and really learning the needs of our families, the population that's in our community, we begin to look at the program design and how we can design a program that really addresses or is responsive to what those needs are. So once that community assessment is done, we want to look at, based on that community assessment, what type of program design best meets the needs of those children and those families. So is this going to be a center-based model? Is this going to be a home-based model? And of course, in terms of scope, how many age-eligible, income-eligible families are there that are not currently served by another program? So what is the size of this program going to be? How many classrooms are we going to be operating? Things like that. As I stated before, we're looking to also identify what resources are needed to implement this program design that best meet the needs of children and families. So Head Start is certainly, we describe it as the most comprehensive early child development program that's implemented across the country. And we know it includes an education aspect. We know it includes a child health aspect, as well as that family well-being aspect. And so, that requires a lot of different service providers, a lot of different supports for those families. And so as a part of that community assessment, our programs are really identifying resources that are there, and also resources that may not be there that the program would then have to go out and recruit so that they can connect those families to those resources and those service providers. And then the third bullet, of course, what resources are needed to implement the program design that already exists within the community. Again, talking about what resources the tribe may already have, what other departments or divisions are there that could provide services to meet the needs of our kids and our families. So going on from there, one other thing that we also have to take into consideration is what type of facility and equipment needs we may have in order to implement this program design. So we're looking at things like location, for example. Where are the majority of our families located, and where does it make sense to actually place a center or place those classrooms? We're looking at, of course, the population that's in the community. And when you take into account class size that's within the regulation, teacher and child ratios, how many classrooms will we have to operate in order to meet that currently unserved need? Then, of course, when you take into consideration the number of children and families you're going to be serving, you're also going to be looking at your staffing structure and the administrative space that you may need in order to support that. Because as I stated, Head Start, as we know, also offers that services for child health and family well-being. And so that requires additional staff to support those areas and to support those families. Of course, we need outdoor play area, and within the Head Start performance standards, there are certain square footages for outdoor play area, and as well as identifying age-appropriate equipment for those children, whether they be infants and toddlers or preschool age children. And for a lot of our tribal programs, of course, our tribal programs are not required to be licensed, but a lot of our programs do opt to be licensed by the state still. In some cases, the tribe may have a division of licensing, but whenever applicable, you want to take into consideration any licensing requirements for a facility. And then we get down, of course, to things like equipment as well. And I'm going to kind of go back to location. So the location of our families and where we place those centers. If we're placing a center in a community where the majority of our children are, but we still have outlying families and outlying communities, do we need buses and things like that for transporting those families? Or do we live in an area of the country that maybe gets 15 or 20 feet of snowfall per year, and maybe we need a truck with a plow, or maybe we need a program vehicle so that we can do home visits. So all those things have to be taken into consideration. Going on from there, perhaps the most vital aspect of program planning and program design is going to come down to your workforce. And for our existing programs, I'm fairly confident the majority of them, the personnel cost is going to eat up about 80 to 90% of their annual budget. And so it's such a huge thing, and it's something that we have to be so intentional about. And so when we think about our program design, we really want to think about what type of staffing structure is needed to implement this program design and provide high quality services. What are the qualifications for these positions? And then, of course, what is the personnel cost for operation to implement this program design? So to support the planning specifically around personnel and staffing structures, we definitely encourage our programs to conduct a wage comparability study. So that study is going to support our programs with providing an analysis of employee compensation in comparison to similar organizations that offer similar services and demographics. So we may be looking across the community and service area at other providers of early childhood education, at the school districts, and maybe what those staff are being paid. Additionally, it's going to provide some measure of program wages and benefits against prevailing wages and benefits within the service area. We know that, of course, that benefit package is a huge part of when we talk about compensation and what we're able to offer staff or potential staff. And it's also going to help us improve our efforts to attract and retain qualified program staff. It's so important for us to really understand the staffing requirements so that when we go out and we post vacancies and we recruit, we're recruiting accurately to identify the best people. That's going to definitely help us support staff retention, in addition to just making sure that our staff are being paid a wage that's comparable to other like organizations in the community. And so I'm going to go ahead and actually pass it over to my colleague Raquel, and she's going to talk about the important part of actually identifying families, recruiting families, and getting them in so that we can provide those services. Thank you.
Thank you, Todd. So now we're going to be talking about eligibility, recruitment, selection, enrollment, and a little bit about attendance. And if you're familiar with Head Start terminology, we refer to this as ERSI. And for those of you who are familiar with Head Start, you might have heard of ERSI being the gateway to Head Start. And we say that sometimes because recruitment, the recruitment phase is really the time where a lot of families are first coming into contact with Head Start and coming into contact with their staff. And so when we talk about recruitment, we always emphasize that relationship-based practices. And we're going to talk a little bit about that while I'm speaking today. Eligibility, recruitment, selection, enrollment, and attendance procedures are some of the most important activities performed by Head Start staff. And by prioritizing equity in these procedures, Head Start professionals can strengthen their ERSI activities. And as Todd talked about at the beginning of the session, equity is foundational to the mission of Head Start and to ensuring fair and just access and treatment for all of the children and families that we're trying to serve. And equity requires ongoing action. And programs must be intentional in developing equitable systems and individualizing their services that best meet the unique needs of the needs and the strengths of the communities and the families that they're serving. And by prioritizing equity in their earthy activities, we can then ensure that those services are accessible and available to families who need services the most. And the focus on equity also ensures that support to families from the moment they come into the program to the moment that they leave the program are culturally and linguistically responsive. And as leaders and advocates and partners and families then can come together to help shape that message to other families in the community as part of the outreach and the recruitment efforts. Next slide, please, Todd. This is weird. I'm usually on the other end. I'm usually the one clicking the slides. Recruiting for Head Start program involves reaching out to families in the recipient service area. So if you don't currently have a Head Start grant, when you do get a grant, you have a service area, meaning that's the area that you're going to serve your grant funds with. The recruitment process is systematic and it's year-round. It's not a one-time shot. Programs are constantly trying to recruit families into the program. And because we know that each family has unique characteristics, Head Start programs will need to be strategic, thoughtful, and creative and inclusive in their recruitment planning efforts. And by tailoring those processes and using a lens of equity, programs can successfully reach all eligible families. So when we're talking about our recruitment processes, we need to make sure that they're inclusive of all families, and recruitment strategies need to be individualized for target populations. And as Todd mentioned earlier, when you're doing that community assessment, determining how many age eligible children and families you have in your area, that's also going to help you to identify those target populations that are most in need of services. And on the slide, you'll see just some questions that you'll want to consider as you start to develop your recruitment strategies. Next slide, please, Todd. And so when working with staff in recruiting families, we need to really consider where are those families located, the families that we're trying to recruit, where are they? And we need to consider places in our community where families may go to look for resources to meet their basic needs. So we're talking about temporary housing or shelters. You might have food pantries or food kitchens in your community. Some areas have mobile health clinics. You might want to look at your TANF or your public assistance office. Homeless coalitions, your ICWA or your state child welfare partners. And one place that stuck out to me that I hadn't even considered before, Todd and I did the session before, and I saw this and I was like, other public spaces. And there were things on here like 24-hour laundromats, or those businesses that are open for 24 hours, you know, places where families who may be experiencing homelessness may be located, right? A temporary shelter where they may go. And when you're looking at recruitment, ensuring that you're having your materials or your information in all of these areas so that you're able to reach those families most in need. One of the other target populations that we serve in Head Start are children with children who may be experiencing disabilities. And it is so important that those staff who may be involved in your recruitment activities, that they're knowledgeable about the importance of early intervention and some of those unique characteristics or services that Head Start offers, such as early screening, as well as supportive services to help families navigate early intervention and special education systems. Next slide, please. So Head Start doesn't just work alone in providing services. We really need to engage our community partners. And when we're engaging our community partners, we're able to reach our goals sooner and sometimes easier. And so we really need to look at, who are our community partners that we could work with. And Head Start doesn't just focus on the families in the program. We're looking at families in the program, but we're also looking at families in the community, right? One of the goals of Head Start is really to ensure that all families are ready, have their children ready for school, and that all families are safe and healthy. And so Head Start focuses on not only individual families and all families in the program, but how can we ensure that we can support the community as well. And so in doing so, Head Start partners with individual families. They set goals. They might work with community partners to look at how can we serve groups of families that are enrolled in our program, and then how can we partner with community agencies to improve services and access for all families in the community. And when Head Start programs are looking for community partners and how do we engage those partners, we really want to emphasize those unique aspects of Head Start. What can we bring to the table? And some of the really, this is not a fancy word, but some of the really cool things about Head Start is Head Start really seeks to engage families and to promote them as leaders and advocates. And we provide opportunities for children to get developmental screenings and health screenings and nutrition screenings. And we're also linking families to services and opportunities in the community. It's not just about a child coming into a center to learn, their ABCs or their numbers. We're working with the whole family, and we're doing it in a holistic and a comprehensive way. Next slide, please. So we talked a little bit about outreach and recruitment, and Todd mentioned some things about eligibility. The Head Start eligibility requirements really describe how to prioritize and enroll those children and families most in need of program services. And the requirements also show how to identify the program options that best meet those needs. And ensuring equity throughout these requirements helps to strengthen all eligibility efforts for the program. And so programs need to consider how staff interact with families, and they also need to reflect on their own internal processes and procedures to ensure that families can provide the required documentation so they can access those services that they're eligible to receive. And so we really need to ensure that our systems are friendly for the families that we're trying to serve, and that we don't have these barriers and challenges that families have to try to climb over just to get services that they need. Next slide, please. And so earlier, Todd spoke about the community assessment. And programs use that community assessment data to help inform their outreach strategies and their selection policies and their procedures for enrollment. And with careful planning and preparations, programs can have the data that they need to develop and implement effective, responsive selection criteria. And families and staff and community members, they can then guide the development of those policies and procedures to make sure that equity is a priority. And making these criteria equitable ensures that programs identify and enroll children and families who will benefit most from Head Start services. And so on the slide, you'll see that these are just some questions that you'll want to consider as you start to develop your selection procedures for families. The one thing I wanted to point out is that there are some federal eligibility criteria for Head Start, but programs can also have additional eligibility criteria based on the needs of the specific communities that they serve. And so it's so important, as Todd mentioned earlier, that programs have that information to ensure that they're planning responsive services and meeting the needs of those families in their area. Next slide, please. As I mentioned earlier, Head Start is committed to family engagement and parent leadership. And staff start to establish these partnerships during the enrollment process. And the enrollment process offers so many opportunities for staff to talk with families and to learn about their strengths and their hopes and their challenges and what they really want from the program. And that's another cool thing about Head Start is we are not only individualizing services for children, but you're individualizing services for families, and you're really meeting them where they are and helping them to navigate the system. Because again, the goal of Head Start is to ensure that families and children are ready to be successful when they leave our program. And so if you look at the slide, it talks about building trust and building positive goal-oriented relationships with families. And it really starts with that strength-based approach and ensuring that we're being flexible with families and that we're being thoughtful in how we're interacting with them and thoughtful in the questions that we're asking and how we're asking them. Because again, if this is a family's first contact with Head Start and they have a not so great experience, that could potentially set the stage for them as they move through the process with the program. And we want to ensure that families feel welcome and that they feel respected and honored when we're interacting with them. Next slide, please. So when we're working with families, we really try to implement a strengths-based approach. And this begins with acknowledging the strengths of families first and respecting and learning from differences and showing openness to adapting our practices based on the family's preferences, shared decision-making, and approaching families as equal and reciprocal partners in supporting their child. And so things that programs want to consider is, again, those types of conversations that you're having with families. Is the space welcoming? Are the staff being supportive? Do we have materials available that are inclusive for all families? If they walk into your building, do they feel like it's a place where they feel welcome? Do they see themselves represented in your materials, in the pictures that you may have on the walls? And then making sure that you provide information to emergency services that they may need as they're working with your program. Next slide, please. And when we're working with families to complete that enrollment process, we want to be flexible in how families can get information to us, as well as when and where an enrollment visit might take place. And in order to reach families most in need of services, it's critical that programs actively identify potential barriers and work with their staff, other community agencies, and the families to ensure that their services are accessible. And one barrier that may prevent a family from accessing services is getting their child to the program. Sometimes families experiencing homelessness may not have transportation, or there might be, if they're moving from location to location, they may not have a set schedule, or their routines may, they may not have typical routines. And I think acknowledging that up front with the family can really help alleviate any concerns that they might have, and could remove a barrier from them or a challenge for them in enrolling their child in your program. If a family wants the service, but they really feel like, well, I would love this service, my child would benefit from this, but how am I going to get them there? How are they going to get there? And so having that conversation up front is really important. Next slide, please. And so the last thing, we're going to talk about is attendance. And for those of you who are in early childhood education, you know that consistent attendance is essential for children to benefit from not only Head Start, but any school experience. And when we look at high school graduation rates and children succeeding later in life, they always go back to that early attendance as early as preschool. And so we want to make sure that we're using a lens of equity when we're looking at attendance and working with families to ensure that their children are able to participate in the services that Head Start has to offer. And so on the slide, you'll see just some questions that you want to consider when you're looking at your attendance policies. And I just want to point out this last one, especially for tribal programs. How are staff mindful and respectful of activities, ceremonial activities or religious activities that might impact or reduce attendance in the program? I used to be a director for a program here in Alaska, and we served remote villages. And if we had a funeral in the community, we shut our program down. And sometimes school was closed for multiple days because of the activities that went along with that death. But also sometimes children might have relatives in neighboring villages, and their family would leave to go to another village because of that, and that would affect their attendance. And so just being really mindful in what your policies and procedures are. And again, those are going to be based on what your community needs are. And one thing I wanted to say early, and I didn't say, Todd, is that another great thing about Head Start is we have these regulations that we have to follow, but you could go into several different communities and they're all following the same regulations, but their programs don't look exactly alike because they are designed to meet their community needs and their family needs. And that is just one of the amazing things about Head Start. So now I'm going to turn it over to Todd. Thank you, Todd.
Thank you so much, Raquel. And again, I kind of wanted to circle back and take a look at some of the key takeaways. I know an hour is a really short time period to provide such a robust overview of what Head Start is, from the time we do community assessment to the time we deliver direct service. But we did certainly want to highlight how important it is to truly understand the communities and where we are now, almost going to the third year of the pandemic and hopefully coming out of the tail end of that pandemic. We've really seen communities across America change at an expedited pace as well. And so it's super important for our programs really to do intentional assessments and really look to see how their communities may have changed. Because over time, one thing that is definitely certain is communities are evolving, and our Head Start programs need to be continuously evolving with those programs, with the communities as well. So it's important to take a look at that. Also, the world itself is changing around us. We know it costs more to provide these services. We know that there's inflation. We know that salaries around the country are going up. And so those are all things we need to be, taking a very close look at and doing the appropriate assessments to be able to propose adequate salaries to retain staff and to recruit the best staff. And then that, of course, I think when we do that appropriately and we design a program that really mirrors what that community need is, it really allows us to do what Raquel talked about and really focus in on what is our bread and butter, and that's recruiting those families that need service and providing that direct service. And All of that certainly goes hand in hand. I know that for tribes who may not currently be grant recipients, it's an opportunity to really take a look at what your community need is and propose something the next time your funding opportunity is available. And for existing grant recipients, that community assessment is always a time to take a look to see if our program design is still aligned with what that community need is, and if our program design is one that allows us to operate in a way where we're providing the highest quality of service possible. So, with that, I did want to go ahead and turn it back over to our facilitator, Mr. Grant, to go over facilitate any questions we may have received either in the chat or that folks would like to come off mute and ask. Thank you.
Hi, Todd. I'm sorry, I'm taking over. For Delroy, good afternoon, everybody. If you have any questions that you would like to add, I believe you have the ability to unmute yourself and ask them. If you're too shy, you can always write them in the chat and we will answer those for you. There was a question earlier if the slides could be shared. And unfortunately, I don't have the PowerPoint or slides, but Todd, if you can send those to me or whoever has them, I would gladly put those in the chat. I know that we will have this session recorded. It's been recorded, and we can sure have the PowerPoint or any resources provided here after the workshop. Are there any questions at this time?
Okay, well, I think if there are no questions, I certainly want to thank all the planners of the conference this week. I also want to thank all of the folks attending and participating in the conference this week. We hope that this information was beneficial, and hopefully once it is uploaded, the recording, it will prove a resource to those programs who continue their planning and are maybe beginning to look at next program year or possibly in the process of conducting these various assessments. But again, appreciate everybody. I want to thank my colleague, Rafael Martinez, for presenting with me, and my colleague, Delroy, for facilitating our session today.
Yes, and last, please do not forget to fill out the survey. We would really appreciate it. We really appreciate your feedback on the workshops or any questions that you may have.
Todd, I also just wanted to point out, if you don't have a Head Start program and you're interested in that community assessment, I believe the link is on that slide. I'm not sure, but there's a full document where you can go to that walks you through all of the questions you want to consider when you're looking at your community needs.
Also, again, before you go, thank you all for attending day one of the 2022 ACF Indigenous Program Conference. We hope that this was both informative and inspiring for you all. Thanks again. Again, please continue to visit the 2020 ACF IPC website to explore the virtual exhibitor hall to view ACF grant recipient projects throughout the United States and Pacific Islands. You can find this link in the chat below. And again, also visit the ACF resource page to access more detailed information on the ACF program offices and partners. Thanks again, everyone, for joining this session. I'm going to put the link in the chat now for everyone to view.
Oh, hi, Mary Ellen. I see you have your hand up.
Hi, Todd. Hi, everybody.
Good to
Are
see
you guys going to be able to travel for Northwest the week of August 15th?
We're hoping so. Yes, ma'am.
Okay, we'll make sure we send out the invite. Sure is good to see everybody, and you all survived, and here we are.
Likewise, very good to see you, and we hope that you guys stay safe up there.
Okay, you guys are some of the dearest people to my heart.
Likewise, thank you. Good to
Thank
see
you.
you.
By the way, I jumped ship to APIA. I'll tell you guys all about it.
Okay.
Love you. Bye.
Right. Take care, y'all. Thank you, everyone.
There is one question,
One more question.
and it's from Donald. Hey, Donald. The question is it possible for all tribal children to be eligible?
Okay, I can take the first crack at that answer. So currently, within the 2007 Head Start Act, it does outline specific eligibility in that. That includes, of course, age, income. It includes things like families who are currently receiving public assistance, as Raquel pointed out, things like TANF and SSI. It also includes families that are experiencing homelessness or children that are in foster care. As of right now, children that are tribally enrolled is not one of the eligibility criteria. However, one thing that Raquel also pointed out is that Head Start programs can also include some of their own criteria in their selection. So it's right now, it's not something that automatically makes a child eligible being tribally enrolled. That would be something that requires some congressional action to change that piece of legislation.
Thank you for that, Todd. Are there any other questions?
Good.
Well, if there are no questions or if you're being shy, I apologize for that. This is a great time to ask all those questions that you may have and learn from our Office of Head Start colleagues who are very knowledgeable about the program. If you don't have any questions, I would like to ask you to please fill out the survey. Don't forget that. We really would like to hear your feedback. And the last thing is that I will, if you would like the slides, I will get that from our colleagues and provide that to whoever sends me their email. Thank you.
We still have some more time, ladies and gentlemen. Any questions we can entertain?
Hello.
Hi,
Hello,
Jenny.
Vida.
This is Jenny. It's good to see everybody.
Likewise.
My question would be around enrollment, because we're still kind of struggling with enrollment. I mean, we're not bad, but we're not way good either. So I was just wondering how long consideration will be given for enrollment. I guess not meeting enrollment, so to speak.
Gotcha. So we are certainly still expecting our programs all to be, working toward full enrollment. That said, do you by chance know, is it, or at least the, I don't want to get too in deep. I know we're on a mixed session here, but what the reason is for the, or what contribute to your challenges with enrollment? Is it, are those children and families still in the community? Those eligible children and families still in the community?
I would say yes. After the pandemic, I shouldn't say after, we're still kind of maybe at the tail end, hopefully. And then with the increase in childcare dollars. And so we had folks who just kind of elected to keep their children home. Or maybe they had a provider that was the auntie or something, so they didn't have to, really be in a classroom with other children. And I guess the other thing impacting us would just be staff shortage. We just don't have staff sometimes to even man a classroom. And especially when people were out with COVID or exposed or whatever, that has kind of impacted us as well. But I would say the children, for the most part, I'm going to say are there. Folks just electing to keep their children home.
Got you.
So
And I think too, in a lot of ways, I mean, that goes back to how our communities have changed, right? You listed a couple of things that have happened. It sounds like during the past 2 years. And so there are certainly things that are going to have to be taken into consideration from a program management point of view. I definitely would love to have some more conversations so that we can go a little bit more into detail. But, going back to your original question, I would expect that OHS will probably issue some type of communication about our expectations of programs working back toward full enrollment, especially as we, I know now we're in like a heavy recruitment time, really gearing up for our next program year. So certainly I would expect that in the fall of next program year, we're really looking for our programs to come back strong and work back to toward that full enrollment. But we should have some more conversations about it.
okay, thank you, Todd. Yes, we're still recruiting and trying to track people down. And sometimes I think it was Rockwell that was talking about it, is helping parents get their applications in or what have you. So we've switched, like with Child Plus, now we can do an online application, which we didn't have that particularly before. So we're trying to increase that effort, as well as increasing our use of social media. I mean, I'm not no social media person. I'm like, but I do have staff who are, so we're going that route as well. So I think that's helping us. We were excited when we got our first one online, so that was pretty cool.
And it's excellent. And this kind of goes back to what we talked about in terms of our community evolving and our programs having to evolve with it, right? In 2022, a lot of our younger parents, if there's one place they are, it's usually on social media. So we also have to make sure that our programs in their communities have a place there as well, because that's typically where those younger people, those younger parents are looking to go. And having an online application certainly, I think, is going to increase your ability to get parents to fill those out, submit them, and be able to bring those children in so that we can connect them with services. So I think those are definitely two ways that are going to prove extremely beneficial. And I would bet that around the country, taking things electronic is probably going to be maybe the most impactful thing a lot of our programs do in terms of recruitment and their ability to recruit families, especially now when, I know we're, like, as you stated, we're kind of hopefully coming out of this pandemic, but we've been social distancing from one another for so long that, expecting families to come in and bring in applications when they really are trying to be safe and stay in their homes and listen to guidance from community leaders, tribal leaders, giving them that avenue of being able to submit electronically is going to be huge.
Todd, and I'm not sure where, I guess we could learn how to do that better. So, we may have some folks who, and I'm talking about staff, who are electronically adverse or whatever you want to call it. But where we can, I'm not sure where we can learn how to do that better and be confident in that, so to speak.
Well, let's have some conversations about it. Because I think first it would help us to kind of learn some of the details of how you guys are doing it now, and maybe we can provide some recommendations, because marketing is one area that I think in and of itself, it could be a full-time job for somebody there at the program, right? Really, our OC coordinators, those people who are responsible for going out and recruiting families, I mean, they have to have a strong sense of marketing, because that really is what's going to bring in those families. Where do we make our presence known? Do we post flyers in certain places? Do we have a Facebook page? Do we have a presence on our tribal website? So all those things I think are going to help. So I would say that probably it's going to be beneficial to get the image out of your program anywhere where we can get it out. but maybe we can have some additional conversations. I know even on our staff, we have a lot of folks who are very good at anything electronic. And we also have some folks who, you know, have previously worked at programs, so maybe we can kind of team up and support you guys in some of that marketing aspect and how you guys actively recruit online.
Okay, then one last comment. Thank you, Todd. Regarding the trauma-informed care, I don't want to start crying here, but we just lost a young parent. I think it was last maybe Friday. And if I understand correctly, it was fentanyl overdose. I think we have 3 of the children in our program. And one, I believe, might have graduated out of our program. I guess that we don't forget that. And along with, you know, just regular alcohol abuse, so to speak, but it's been pretty traumatizing. So, and this young man, actually, he's my relative. He'd be my first cousin's grandson, and his services will be Friday, I believe, Thursday and Friday. So I kind of appreciated that part of it, you know, including that trauma, you know, as we're looking at families and whatnot. And as you know, that can just affect any level of income, actually. But it's really scary. So Todd, you know BZ, right? And when I told her about the death, she said she just started crying because we're losing our young people to that, our young men folk, and it is really scary. But I just want to say I appreciated that part of that. When I said the questions were really good, and I wanted a copy of the slides so we can really think our own selves and think through how we approach what we're doing. Thank you.
You know, certainly, you know, we are sorry to hear that, and our condolences to the community there. But I think also that's an example of the incredible demand that's on our Head Start program staff to support families through something like that. Because as you mentioned, you know, something like that is certainly going to be deep rooted, and it's going to be long lasting, and the impacts of that are going to be long lasting, certainly for the children of that individual. And it really goes, I think, as an example of, you know, for our family service workers and those individuals who go out and work to support those families, really what the demand is of their job, and the resources and the type of training that they need to be able to effectively do their job, and however possible, support that family as they go through that. You know, and also talking about supporting other children, other staff members, because certainly we know that, you know, in tribal communities, so much is connected, and so many people are connected, whether through friendship, whether through family. And so we know that that doesn't just impact one family. So one thing I certainly would encourage, I know that we're gonna have some different training opportunities come up, different resources provided, is to make sure our family service workers have access to those resources, have access to that training, because it's an incredible demand on them to be able to try to support not just the family, but you know, our other staff, our other managers, to support one another and the staff as they go through that and they grieve.
Thank you, Todd. Appreciate it.
Well, thank you, everybody, for participating in this workshop. We really appreciate your time. We appreciate your comments. And at this time, we are just about on the hour, and we want to be respectful of the time. And I'm sure some of you may be participating in the networking session, which is a great opportunity to talk to others about your program and what you can do or what are they doing, and probably find solutions to some of the challenges that you may be having. So on behalf of Head Start, I want to thank Todd, Raquel, and Delroy, and also you for participating, and we will be in touch with you with the slides shortly. Thank you.